drug development, clinical trial design to look at gut metrics and systemic inflammatory profiles that are altered by having intestinal permeability or gut dysbiosis.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
I'm doing great. You know, Hadar, do you ever sit back and think about all the little bugs on and in your body?
Most days I do. I do think about
That's
little
when you're
things.
not thinking of food, right? Of course.
Exactly, yeah, because you see, you are ahead of me 3 steps. You know me so well. Yes, I think about these little critters that fill our gut and our skin and our environment, if we're honest. And but I really think about them when I eat. Like, what food should I eat that will really make my microbiome happy? And it gets confusing, man, because there's so much information out there. I always think, what's worse, the fact that we figured it out how to do this, because now we have so much data coming out, it's impossible to keep track. And do we really need to keep track? Dude, I'm so confused. Can you please help me?
You know, I'm going to make like the black eyed peas and say I got a feeling, but you know what I do really have? I got a gut feeling that we're going to have a good podcast here today.
Yes.
So we are lucky because we have Dr. Jean McGhee, who is joining us. She's an Associate Professor of Dermatology at the Harvard Medical School. And she's also the Director of Microbiome Research in the Department of Dermatology at Brigham and Women's Hospital. So Jean, we are super excited to talk guts and bugs and everything in between.
Thank you, guys. I am very excited to join you today, this morning, to talk about gut microbiome and dermatology.
Yeah, Gene, so maybe we should start at the beginning for a second, and maybe you can frame it for us conceptually. Why should we even be talking about this, right? Because the gut is the gut, and the skin is the skin, and the microbiome. Why should there even be any relationship between the bacteria that live normally in our gut and skin health and skin disease in particular?
Yeah, I think this was initially described many years ago, that there might be a connection between gut and skin and brain. So like the stress, can cause, gut dysbiosis, and they can lead to skin inflammation, like acne. So that association was first described many years ago, and I think it really didn't come about until recently, with the advent of microbiome sequencing that allow us to see that there are a lot of these inflammatory skin diseases like acne, psoriasis, atopic dermatitis, HS, all have some sort of gut dysbiosis. So what does that mean to skin health? So what we think is happening is that there's gut dysbiosis that leads to sort of that triggers systemic inflammation, that then leads to skin inflammation, that then feeds back onto gut dysbiosis, worsening of gut dysbiosis and worsening systemic inflammation. So that is that vicious cycle that we talk about when we talk about gut-skin axis.
That's excellent. And Jean, maybe you can frame for us what you are doing, because you are, you do something very special, right? You both see patients, but you also have a laboratory. Maybe you can tell us why you chose or how you recalibrate your interest in this problem of the gut and skin and brain connection, as you mentioned, to set your career in this kind of structure.
And sort of going back to when I was deciding dermatology, as a specialty, I was actually interested in, GI potentially as a, potential, training, clinical training. So I was always interested in the gut. And then I think the real interest came about when I was in residency. That's when really people started to talk about collecting stool samples and doing gut microbiome sequencing, and how gut microbiome is really important in regulating host immune system. So I started to really get into gut microbiome, and the disease entity at the time that I was really interested in was rosacea. As we all know that small intestinal bacterial overgrowth is associated with rosacea. So I decided to do a small project as a resident, collecting stool samples and seeing if there is any interesting, gut dysbiosis phenotype that I can identify in rosacea patients. So that sort of started me on this path or journey towards kind of describing gut skin axis in dermatology, and what we can learn about gut health that can help skin health. So that's sort of the journey that I've been on. So I would say I'm probably one of the few, if any, dermatologist or dermatology researcher who collects stool samples from our patients and mainly interested in their stool habits, and diet and gut health. So hopefully I can start this field and make some meaningful contribution to our specialty.
Well, welcome home. I think you have at least one dermatologist here who's doing that as well. But I think what's unique about you is that you also take that to the lab. But I wanted for our listeners to know that Jean is not speaking just from a perspective of being in the lab and looking at data. She then goes back to the clinic and sees real patients with real problem. And maybe at the end of this episode, we can get back to kind of the practicality of all of this. So I want to start with some fundamentals, Jean, because you threw a couple times already the word dysbiosis. Do you have a working definition for what that means?
Yeah, so when we say gut microbiome, we're talking about bacteria, virus, any sort of microorganisms that live in your gut, right? So, and then when we're talking about gut dysbiosis, we're talking about composition, diversity, their functional capability. So any alteration in that, or any one of those metrics that are disturbed compared to what we consider healthy, is gut dysbiosis. So it's a very broad term when we say gut dysbiosis.
And so I like to think is like, who's there? What kind of species are there? Which families are there, and what neighborhoods they live in, and how they interact with each other. And that's kind of the study of the gut microbiome. And sometimes you get like this bad gang that takes over a neighborhood, and you get dysbiosis.
Yeah.
So okay, so
yeah, you get these mafias. Now, speaking of that,
yes.
Actually, just to jump in here, Gene, it's hard to say. I guess there are many definitions for a dysbiotic gut. Is there something as here's the signature healthy gut, or here's the signature dysbiotic gut? Can you give us more insight into what healthy means or what unhealthy means?
I think that's a really good question that we don't have a very good answer for. I think the gut microbiome varies, individual to individual. I think it varies in different, like sort of racial group. The diet intake changes your gut microbiome. So many factors that go into establishing your stable gut microbiome. That there isn't really, like we would say, like quote unquote healthy gut microbiome. That's sort of a signature that you must have this, But it's, the NIH launched the Human, Microbiome Project and profiled many, many, subjects, gut microbiome. And it's sort of a healthy microbiome comes from that sort of broad, people who don't have any defined, disease entities. And then, what we're seeing there, even then, there's a big, I would say somewhat of a variation. So it's not a very exact term. So when we study, gut microbiome in, dermatology patients, we basically just say, those without, acne, those with acne, and then we'll call that, so it's kind of a experimentally defined term, I would say, when you say healthy gut microbiome.
Do you think one of the analogies I've always personally used and I've seen used is like looking at different cities? Like, if you look at, say city A or city B, I mean, we know when a city's run well, they have good infrastructure, maybe they have like
Mhm.
good services, but they don't exactly run the same way. We just know they're run well. But we
Yep.
also know when cities aren't run well, maybe they have like raw sewage running in the streets, which we know would be like a common theme would not be good.
Yep.
So we know that that's not healthy. But maybe that analogy could make sense then, because there are
That
many ways
yes,
to be
that's a
healthy.
very good analogy. So we just basically go by, okay, like, phenotypically you seem to be healthy, so we'll call you healthy, and what what we see from your gut, we're gonna say healthy. And obviously there's a group of people, we, have a disease phenotype, and we say, okay, like, you must have a unhealthy gut microbiome, so let's compare and see what we see in terms of the difference.
Well, on that note, then, and I don't want to steal Hadar's thunder, but I wanted to talk about food.
Yeah.
And uh,
Sounds delicious. Let's go.
yeah, we know how much Hadar loves food, but the real question here is, can you tell us, like, how does diet impact the gut? I mean, there's a lot of folks that are looking to say, okay, maybe I have a healthy gut, maybe I don't, but how can I influence it? What are the things that I can do that can influence it in a good way, or hopefully they're not influencing it in a bad way? But I'm curious, what's the role of diet here?
Well, I think our moms were correct when they say eat veggies, eat greens, right? So, I mean, fiber, eating, diet high in fiber is certainly helpful. We know that, fiber gets metabolized, by the gut bugs, and that the gut bugs then produce short chain fatty acids. And we know that that's anti-inflammatory, that helps build your gut barrier. And there's whole, right, like the wellness industry that's focused on leaky gut syndrome. From my perspective, from looking at it from evidence based, yes, I mean, there is a, gut barrier disruption that happens in certain, disease, phenotypes. So it is actually, scientifically proven there is something, I wouldn't necessarily call it a leaky gut syndrome, because that puts leaky gut in the front and center, and that, that everything drives, all your disease is driven by leaky gut, syndrome, the way they define it. But we do have, increased intestinal permeability that's happening, and short chain fatty acids, promote repair of that. So it promotes tight junction protein expression to build that barrier, back, so that bacterial translocation doesn't happen, and systemic inflammation and immune activation doesn't happen downstream. So fiber is very good. And people have looked at different diets. Mediterranean diet is certainly very helpful. It does lower certain inflammatory markers of aging, so it helps you live long and healthy. So that's helpful. Diet, high in fat, sugar, we know that that also lowers short chain fatty acid production. So it does all feed back into the gut, and how the gut bug interacts with these, dietary component to help you prevent downstream inflammatory and immune activation. So that's how I would, describe it. That veggies are helpful, Mediterranean diet is helpful. Those are sort of evidence-based.
Yeah. Thank you, Gene. That was great. And I like your idea of, eat vegetables or some messaging that is kind of simple or increase fiber. I kind of like to tell that to my patients because there's so much information out there and so many different diets, and it's very, very difficult. And also, sometimes people are under the impression that eating healthy needs to be expensive, and it's not. Most sources of fiber are actually very affordable, and you can work well with that. So, but I want to make a comment on the Mediterranean diet here because when I ask my patients, what is Mediterranean diet? Invariably, they list food such as fish, avocado. They list the fatty part of the diet. And I want to suggest to all our listeners to be very careful of that because the Mediterranean diet is actually built mostly, as Gene said, on vegetables and some healthy fats. And I think most people who think Mediterranean diet see it as a license to increase a lot of fat. Now, sure, fish has, salmon has healthy fats, avocado has healthy fats, but fat is fat. And so if you eat a lot, if you eat all day just salmon and avocado, that's probably not a good idea. So just to recalibrate, Mediterranean diet, the base of that pyramid, most of the calories you intake should be probably from good sources of fiber, not
Olive
the fat.
oil is very, very important. Yeah,
Yeah,
olive
but I'm
oil,
telling you, I'm asking patients all the time.
plant-based
Yeah, I
food. Yeah.
say, sorry, go ahead.
Oh yeah. Just saying. Yeah, totally agree with you. Olive oil, plant-based food is really, really important.
Yeah.
So that lots of fruits, whole grain is important. So when and also another thing that people think Mediterranean diet is, a lot of red wine, which isn't really part of what we're recommending. Nuts and seeds and whole grain, and a lot of vegetable based diet, plant based diet is very important.
Yeah, and so I wanted to ask you then, because the question then comes up, okay, this is kind of what the healthy gut that we see. We don't know exactly what it is, but when it's wrong, I know, I'll tell you. And we know that we want to increase fiber and short chain fatty acids. And then comes in the whole industry and says, well, here's what you need. Let me give you that little pill. So let's talk for a second about these various supplements and probiotics and prebiotics. Can
Yeah.
you maybe give us a working definition for what's a prebiotic, a probiotic, maybe a postbiotic, if you want to talk about those? And what's your take on these?
So I do, believe that the evidence is there, or at least we're building evidence towards, pre, post, probiotic, um, and how we can, use that to alter the actual gut microbiome composition, thereby also, altering the gut function, right? Like that is the whole goal of whatever you give, pre, pro, postbiotic. That's the whole goal, right? Like, is how do we change the gut microbiome, and that also leads to the gut function being changed, like increased, short chain fatty acids, and downstream, inflammation and immune activation in the host. So I do think that the evidence is strong that the gut changing the gut microbiome structure and function would help us. But the way we go about how we're gonna give you this gut bug so that we can change we'll change your gut microbiome composition and help you this way. That sort of one-to-one approach, like you're missing this, so I'm gonna give you this, in this amount, doesn't seem to really work because studies show that individuals have differences in terms of how they receive those, let's say, probiotics, and how they can, probiotics can come in and colonize individual person is very different. So I think the sort of research should be moving towards how do we really provide individualized, personalized, maybe probiotics, prebiotics to help you, your, gut health to be the most optimal for you. I think it's where it should be, going, because as we said before initially, that everybody's gut microbiome is different, so that one size fits all, over the counter, that perfect probiotic, I don't think it's the at least from, my research and, my sort of opinion is that that's probably not the right way. And with AI and, ability to data process, individual gut microbiome, I think we're gonna get there where we just basically optimize your gut health, in a
So,
very personalized way.
so Gene, I have two follow-up questions. The
Yeah.
first one is, how does this look, right, in the clinic? What do you envision this is looking like in the clinic? And let's be specific. Let's be in the dermatology clinic. And then just a quick ratio question. How much do you talk to your patients about the supplement, or how important is the supplement versus the diet? Like, what's the breakdown? 50
Ooh,
50?
yeah, this question comes up a lot in the clinic
Because
too.
I feel like people say, well, I'm going to go and have some McDonald's, and then I'll pop in a couple of microbiome pills, magic pills, and everything's going to be good.
Right?
Well, I mean, there's a animal study to show that that could actually work, right? Like that was the whole, I don't
Kill
want
my
to.
premise, Jen. Kill my
I don't.
premise.
I
No, go
think,
ahead. Sorry. Go.
people want to believe, right? Like that. Oh, maybe that there is a special gut microbiome solution to fixing obesity, right? Like, how is it like, that person, right? That friend of yours that eats whatever they want and they stay skinny, or, and how do they do that? Like, so there are animal studies that show that you could transplant, stool samples from an obese, person and a healthy weight person into a mice, and then that mice then gets on a very unhealthy diet, and the mice that got it, the healthy weight person's, gut microbiome remained, uh, normal weight,
Yeah.
by eating unhealthy, right? So that just kind of feeds into that, excitement that, maybe we can eat whatever we want as long as we can, like, maintain our gut microbiome in certain way, so I can't discredit that, that idea completely. But certainly, I mean, that's not, what I would recommend to my
Yeah.
patients.
And I would argue that getting to the quote unquote right weight is not the only outcome we care about, right?
Yeah,
So there could be other outcome. We talked about the brain.
outcomes,
We're not
yes.
touching. Yeah, we're not touching
Yeah.
about how the brain is connected, hormonal changes, all this other stuff that's really
Aging
so key to this.
markers, yeah.
Yeah, but no, but that study is super interesting. So let's get back to your vision of this personalized medicine,
Yeah.
in which we kind of do this. What we test the gut on people with psoriasis, and we can personalize the treatment. How does that
Yeah.
work? What does that look like?
So my current, my current research interest right now is actually looking at delving more into atopic dermatitis. We have a lot of research that shows that there is a gut dysbiosis in atopic dermatitis patients, that, like, over probably 40 studies to date have documented, all agree that there's gut dysbiosis. We don't have a very specific gut dysbiotic signature. Like, I can't tell you, like, if you have these, signature dysbiosis, you have atopic dermatitis. We don't have that. The studies don't really agree. but they all agree that there's a gut dysbiosis. And recent studies that have come out show that atopic dermatitis patients have increased, potentially increased, intestinal permeability as well. So we all also know that atopic dermatitis is really not just a skin inflammatory process, right? You have systemic inflammatory, phenotype, the Th2 immune activation in the, sort of systemic circulation we know is present in atopic dermatitis patients. So it is not only skin disease, but it's a systemic disease. So then as a dermatologist, we focus just mainly on the skin, right? All the drug, development and innovation is looking at the skin metrics to show that it is efficacious, to give dupilumab. But why are we not looking at the gut microbiome and potentially also intestinal permeability in these patients? And how do we support, like, are these drugs that we're giving to these patients are supporting gut health and systemic inflammation? So my vision for some of the chronic inflammatory skin disease management is looking at gut health. So I potentially see profiling the gut microbiome, profiling their gut barrier structure and function, and how do we then able to manage gut health, which hopefully in turn also help the skin health and just overall improvement in someone's overall health is sort of how I envision the future of dermatology. So I do see, or at least I want to see that we look at gut microbiome profiling as part of a future drug development, clinical trial designs. Let's look at gut metrics, and systemic inflammatory profiles that are altered by having intestinal permeability or gut dysbiosis.
So, Jean, I want to maybe close the circle now and talk about some specific diseases where we do have some evidence. Just for some of the clinicians listening to this or patients who are listening to this, which disease you think has met some kind of good evidence bar to say, hey, in this disease, we can do some testing and we can provide some intervention that will alter the gut microbiome in a positive way. Can you give us maybe a couple of good practical examples? You were talking about research in atopic dermatitis. Earlier, you mentioned rosacea, for example. Is there something there that clinicians and patients can rely
on? Yeah, that's a really tough question because I constantly have to say we don't have yet enough sort of evidence-based data to support, let's give somebody a gut microbiome testing and then change their diet, change their supplements to help them improve their skin disease. I know that there are a lot of naturopathic doctors who are looking at gut microbiome profiles. They are actually doing not doing the whole gut microbiome sequencing, but looking at certain bacteria that are known to be elevated in atopic dermatitis patients. I recently talked to one who have shown in her cohort of patients that every time she sees certain bacteria, gut bacteria come up, in all of her atopic dermatitis patients. But it's not a routine clinical practice for us to recommend, unfortunately, gut microbiome sequencing, on every patient. And how do you then interpret that, and how do we make very clinical, practical recommendations for the patients? Not there, but certainly the general recommendation is there in terms of eating right, and necessarily recommend certain probiotics, but diet I do recommend fiber, fermented foods, low, red meat consumption, no high fat, no processed food is terrible on gut microbiome. High glycemic index food, avoiding that. So that's sort of the general recommendation for all my chronic inflammatory skin disease patients. But in terms of specifically giving, I would love to tailor very
But we're not
personal.
there yet.
We're not there yet, and
Yeah.
there's. I wish we can get to a point where we can actually, profile people's, gut microbiome consistently, and be able to provide, certain suggestions, more individualized suggestions. We don't have that, and that's always a conversation that I have with my patients, because they know the type of research that I do, and they come in very interested, and wanting to talk about this, and I have to disappoint them all the time, but hopefully in the next maybe 5 to 10 years, we don't have to, I don't have to say that.
Well, Jean, you have not disappointed us, because I think there's great value in having the right vocabulary. Both patients, doctors, other healthcare providers, anyone in our community who has a good vocabulary and understands where the science is right now and what we can talk about and what we probably should just put right now under the bucket of TBD, right? And so I want to thank you for that. I think all our listeners learned a good amount on what diets really support a good, whatever that means, healthy gut microbiome. Definitely understand the relationship to skin and inflammation in the skin. And I want to thank you for your time, your expertise, your research, kind of really trying to push the envelope on that, and hope to see you soon at IDS.
Thank you so much for inviting me. It was a great conversation.
And that's a wrap for today's episode. But if conversations like this get you all excited, that's exactly what the Integrative Dermatology Symposium is all about.
And I'm all excited about it. The 9th Annual Integrative Dermatology Symposium will once again bring together clinicians, researchers, and educators who are shaping the future of dermatology. And this year, there'll be a focus on precision, regeneration, and whole person skin health. It's happening from August the 20th to the 22nd at the Grand Hyatt Indian Wells in Palm Springs, California.
IDS is where evidence meets application. Through expert-led sessions, real-world case discussions, and meaningful collaboration, or in plain English, IDS is where you get to talk to a whole bunch of people who are equally skin-obsessed.
I'm also equally skin-obsessed. If you want to be a part of the largest community in integrative dermatology, use the code PODCAST15 for 15% off registration at integrativedermatologysymposium.com.
That's integrativedermatologysymposium.com. We can't wait to see you there.